Welcome everyone. Thank you for joining us. Today we're focusing on how you can use your own sphere of influence to help drive change for occupational therapy. We're going to start by introducing the new campaign that will launch during OT Week and explore what we're trying to achieve and why now is the right time. After that, we'll move into a practical session on identifying and using your sphere of influence with time to reflect, share and ask questions. First, I'm going to ask you to answer a poll that will pop up now. It's about how confident you feel in reaching out locally to influence change. And we'll ask again at the end and see if the dial has shifted at all by the time you finish this session. So before we continue, I'm going to go around and ask everyone to introduce themselves, and I'll start with Karen.
Hello everyone, I'm Karen. I'm Director of Practice and Innovation at the Royal College of Occupational Therapists.
You've already met me. I will introduce you to some of our policy and public affairs team who are here as well. So Cleona, would you like to introduce yourself?
Hi everyone, Cleona McSherry, the Policy and Public Affairs Lead for RC OT in Northern Ireland. Great to be with you all this afternoon, thank you.
And over to Katie.
Thank you, and hi everyone, I'm Katie McGregor, the Policy and Public Affairs Lead for the Royal College in Scotland.
And they're not here right now, but we do also have Paul, who's our Policy and Public Affairs Lead in Wales, and Joe, who's the UK Policy and Public Affairs Manager, who also oversees activity in England. So just to reiterate, for those who have just joined us, we are recording this session. So the recording will be put on our social media channels and on our website later on. Feel free to switch off your camera if you would rather not be on camera for that. This OT week, we'll be launching our new annual campaign, Right Time, Right Support, Unlocking the Power of OT. Hopefully you've seen something about it already. The campaign is all about positioning occupational therapy where it belongs, at the heart of health, education and social care. We're showing how OTs deliver the right support at the right time, often preventing problems before they escalate. It's a powerful message, and it's one we really want to amplify, not just with the work we'll be doing directly, but also hopefully through all of you. And that's what this is about. To do that, we need to think about who we already have access to, who we know, and who knows us. So that's where your sphere of influence comes in. It's not just about who's in your network, but how you can use those connections to help spread the message and drive change for occupational therapy. So what exactly are we driving through this campaign? It's not just about raising awareness, it's about shifting mindsets. We want systems to move from reacting to problems to preventing them. We want occupational therapists to feel empowered to speak up locally and nationally. And we want to make a stronger case for investment by showing the real impact of OT through stories and evidence. We're doing this now because the timing matters. Health and care systems are stretched, as I am sure you are all more than aware. Prevention and early intervention are national priorities, and occupational therapy is part of the solution, but it's still not recognised as widely as it should be. And that's why your voice is so important. You already have connections, you have people who trust you, listen to you, and can help amplify this message. So next, I'm going to hand over to Karen to talk about how you can use your existing relationships to help drive change for occupational therapy.
Thanks, Samantha, and I've taken control of the slides just to let you know. Okay. So I'm going to talk about sphere of influence and how to use it. I think it's fair to say as a profession, we can often feel there's a glass ceiling for leadership, but we all have the power to influence decision making. And to help us consider where we can make a difference, I'm going to just take an example based on Gestalt's locus of control, which some of you might be familiar with. I think it's a really simple tool that can help us consider our sphere of influence and direct our energies and our activities accordingly. So if we just take a minute, and if you've got pen and paper, just draw yourself a circle. And if you think about the center of the circle is where you have direct, what's within your direct sphere of influence, where do you have control around how you get messages across, the conversations that you have, the thinking and the shift in mindset that you want to achieve. And as you work your way from the middle to the outer edges, this is where that direct sphere turns into more indirect opportunities to influence. And then outside of the circle is anything that's beyond your sphere of influence. So, for instance, how the Treasury decides to do its annual spend on health, social care and education would be a good example of beyond your sphere of influence. So please share in the chat your examples of what's within your direct sphere of influence, but I'm just going to pause for like 30 seconds or so just to give you the opportunity to mentally draw that circle and fill it in, or take pen and paper and just have a go and think about those direct examples. And thank you for Martine. You've put an example in on the chat. It'd be great to start capturing people's thoughts and ideas. That silence isn't great for a recording, I realise, but it's important just to have that sort of stop and moment of reflection. So it is a simple exercise, but it's one I still use to untangle priorities and my approach to influencing work. So sometimes it's just being able to step back, isn't it? And the simpler the tool, the easier it is to actually incorporate it into your thinking. So once you've mapped your sphere of influence, it's then important to think about who they include. I mean, some of them will be professional contacts, so it's your direct colleagues, might be your managers. You may actually have contact with commissioners and service leads. It's your community connections. Who do you work in partnership, whether formally or informally, across services and across the system? So who are those advocacy groups? Who do you work with, perhaps in charities, voluntary sector? Who could actually start to sort of amplify and advocate your messages? And then just thinking about your networks. What have you got available to share ideas, to talk about what you're doing? It's moving that from individual think to sort of wider and tapping into the hive mind and building on your original thoughts and ideas. And then personal contacts. Actually, where's your sphere of influence with family, with friends? We know that if people go to their GP, we know that if they go to the clinic run by their elected representative, maybe their MP, that they make an impact, because the more the public says, I need to see an occupational therapist, or I can't see an occupational therapist, I don't know how to see an occupational therapist, that wakens interest in other people that perhaps just don't think about our profession on a regular basis. And then understanding your levels of influence. So you've thought about what's within your sphere. You've thought about the different categories of people that can be your contacts to support getting your message out. But then thinking about how else do these different categories, what's their purpose? Are they decision makers? Are they people who can directly shape policy or funding or service design? Are they gatekeepers? Are they the people that controls access to decision makers or platforms? And who are the amplifiers? When I talked about those partnerships and those networks, they are the people that can really amplify your message. We know that when we were trying to establish occupational therapy in primary care, once GPs started to talk about occupational therapy and the difference it was making within their practice, we got a whole new audience opening up and different decision makers listening. And then who are the allies? Who shares our values and can support our advocacy work? So for instance, it's often other allied health professions that we can ally with. But it may also be the charity sector who are advocating on behalf of different population groups with different conditions that can also really speak to occupational therapy and our value. And then the next step is thinking about how you might reach out. How can you frame occupational therapy as a solution to the challenges your contact cares about? It's always trying to think about what's their top priority, what are they concerned, and then thinking about how you can frame what you do as meeting that challenge. And I've seen some fantastic examples of business cases that have been put forward for occupational therapy and they just haven't landed. And it's not been because the business case is weak in any way. It's because that is not, it's not answering the top challenge within the organization at that time. So it's really important to understand what decision makers are wrestling with. Use campaign materials. We're going to be sharing that, launching them as part of OT Week, all about the right support, the right time narrative, and materials that you can use and adapt. And then make it personal, including a short story or an example from your own practice really gets people sitting up and listening. So when we talk to decision makers at a national level, we will talk about, we'll put across our key messages. This is what occupational therapy can do as part of the solution. We will give any evidence that we have to support that. We'll talk about a service and say, for example, in Manchester, they have done this. But it's when we then give a story about an individual person, it really helps. We see it click. You see it in their eyes and they go, actually, I've met a constituent who had a similar situation, or my sister had a similar situation. So those stories are really, really powerful and helps people to really put some flesh onto the message that you're giving them. And then offer a call to action. Ask them what you want them to do. What can they do to support, to share, or to help you, if they're gatekeepers, for example, connect with others? So always go prepared to have an ask. Otherwise, why are you having that conversation with them? So I'm going to stop sharing there and come off the main screen because we have got some fantastic members who already have experience of doing some influencing work, and they'll demonstrate how they've done it at different levels depending on who is within their sphere of influence. So I'm delighted I can see Claire on the screen. We've got Claire Simpson and Laura Emmett, who are occupational therapists from Cheshire East Council. We've got Alex Gigg, and Alex is a lead occupational therapist at Swansea Bay Health Board in Wales. And then we've got Leslie Bowden, who's the head of occupational therapy and professional lead at NHS Lanarkshire and South Lanarkshire University Health and Social Care Partnership. So I'm going to go to Claire and Laura first. And just ask you've got a few minutes just to give us a little bit of a summary of what you have been doing in terms of influencing.
Thank you, Karen, for our introduction. I'll try and keep it really brief, then I'm going to pass over to Laura to give you hopefully a snapshot of what we developed, which has made a real impact in Cheshire East Council here. So we acted on OT Week last year. And I implemented spotlight sessions across the week with a vision to, like what you've mentioned earlier, shift mindset, bring a voice to OT and really get the work that we do out there beyond the remit of the council, actually. So we set these spotlight sessions up to inform our service, but I wanted to go beyond that, so we got our media tech team involved and we reached out across LinkedIn and across social media and we ran some informative sessions throughout the week to speak of really the work that we're doing. That involved, Laura, many aspects of our service, really, didn't it?
Yeah.
Sorry.
Yeah, it did, absolutely. And I think the spotlight sessions having the focus on different areas. So we focused on some of the projects that we were doing within the OT service, but we also then put on, there was the Wednesday walk session, so that was about getting away from our desks, and that was across, like Claire said, across the council, and wider across other social networks. Yeah. And we had a lot of engagement from senior management, which was brilliant. Previously we'd had some newly formed OT teams, so it was a great opportunity for us to really showcase what OT is all about in a social care setting, because there hadn't been that voice there for some time. So actually the OT week last week, along with the restructure and redesign of the service, we've also gone through a big recruitment campaign so we've been really fortunate with it being really successful with lots of new OTs to the team. And I think having the engagement with all the senior leadership and management team there within the spotlight sessions, and their attendance was invaluable for us. And then I think from that as well, it's really stepped up our names
Profile.
within the profile within the council. We went on to win Social Care Team of the Year within our internal social work awards, and we've recently as well, for a proportionate care project that we've done just on Monday just gone, we've just won Social Care Team of the Year in the National Back Exchange Awards, based on our moving and handling team and proportionate care. So I think having that profile raised within the boost from last year's OT week has really given us that boost to to further develop and bring on OT week 2025 with plans ahead.
Fantastic. So it sounds like it sort of propelled your confidence as well to keep doing it. And congratulations on those awards. Can I just ask, going through the process last year, what was the thing that surprised you? Was there any element of doing it that surprised you hadn't anticipated?
I think it hadn't been done before, so expectations didn't really know. The services are, as we all are, really busy, really time consumed, and I think the nature in which we rolled the week out worked. It was like this: you can flex with your demands to be able to attend. So surprising was primarily that week alone was attendance, and to actually have senior leaders, directorship in attendance and engaging in the sessions. I mean, I felt quite heartwarming and quite phenomenal, really, is it got raw and it got real. And so you had senior members of staff in Cheshire East Council speaking of what you've just mentioned, real life experiences with an OT in their personal life, in their family lives, and bringing those raw conversations to the table. And like what you've said just before we came on, is it brings that reality of what we're talking about, the amazing change we're making, but the real change is in the person and in their lives and the effect they're having. And that's what the conversation is in all of these spotlight sessions we ran across the week was surprising, but immensely full of value, and just helped because it was a multidisciplinary spotlight session from all areas of the council that gave people real true reflection on what we as a service and as a profession can do and are doing. So that was amazing.
That's fantastic, and I think you're absolutely right. Everybody's dealing with the day-to-day challenges, with workforce capacity, money, etc. Just being reminded about why we do it and the difference it makes to individuals really just sort of makes people stop and pause. And certainly I've sat in various sort of groups, and you've had eminent speakers, you know, giving a presentation. Everybody's on their phone, they're doing, you know, nobody's fully there, but as soon as somebody talks about their own lived experience, people stop and listen. So and everybody in this virtual room, everybody watching this recording will have some fantastic stories that they can share to really illustrate the value of what they're doing. So it's available to OT support workers, learners, all the way through our career, isn't it? That we can draw on those examples, because they keep us motivated, don't they? They keep us doing it.
I think as well, I was just going to say just
Nora.
about the spotlight sessions. I think the key as well was to keep it within, you know, an hour-long session, so people are engaged and that they will fully participate in that as well. Because I think if it had been bigger or longer sessions, that, you know, we might not have got that same attendance. People could take that time out to join via Teams. So I think that element of it worked really well in the spotlight sessions, just having it short and sharp, really, so that that engagement remains.
Yeah,
brilliant. I think that's a good tip, and that's why we tend to do our cafes and our sessions at lunchtime, because people can dip in, and if they need to have their camera off and eat, they can do, but it can still be part of it. Thank you so much for kicking off with that example. It's brilliant, and congratulations on the awards as well and getting that recognition. That's fantastic. I'm now going to go to Alex.
Thank you.
Alex, I saw you come into the virtual room, so I know that you're there. Hi, Alex. Hi.
Yeah, hiya.
Do you want to just give us a bit of a summary of what influencing activity you've done?
Sure thing. First thing though, just in case anyone sees my background, I'm not in Swansea Bay anymore as the lead OT.
My apologies,
That's okay.
Alex.
That's no problem at all. I'm now in Cardiff in a AHP strategic lead post, but obviously a very proud OT, and moved into that post primarily so I can hopefully influence more in wider forums as well, particularly around the OT voice. So in terms of the things that I've influenced or led on over the past couple of years was in 2 different health boards, was establishing the primary care offer for occupational therapists. So in the first health board, I went in as a band 7 OT into 1 GP practice, and very much just kind of tried to hit the ground running. GP practices, as anyone has worked in them, don't stand still and don't necessarily want to understand why you're there. They just want to know what you're going to do for them. So it's very much going in, trying to influence by doing more, so showing people the value of OT. And from there, it grew, I guess, in terms of we were able to achieve full population coverage across our clusters, or like your PCNs in England, I guess. It's the best way of terming it. So we were able to establish a band 7, a band 6 and a band 4 generic tech in each of the 8 cluster areas that we had within that health board at the time. And then equally, when I went into Swansea as lead OT, it was a brand new service, virtual ward service, working with primary care clusters primarily. Again, it's about establishing that OT practice within that space and that forum. What's the value of OT? How are we going to deliver what's needed out in that community? I think within that role, I guess the best way to term it is primary care and community is probably the best terminology for it, rather than just primary care specific.
Yeah.
And so within that, it obviously took an awful lot of influence and in conversations, because clusters are different. GPs are primarily private businesses and their own entities, obviously with their contracts back into the NHS, but they've got their own stipulations of what they require and what the value they see. But when you also within core service and funded through a health board, they've also got things that they want to see. So it's juggling, I guess, the multiple masters situation that you've got, knowing that you've got a range of different stakeholders all wanting slightly different things, slightly different data, slightly different outcomes, being willing to put your head above the parapet, shout about what we do as OTs, and not be a shrinking violet, I guess, is probably the best thing that we did. But what it managed to achieve really was raise that profile of OT within that space, so much so that when I did actually go to Swansea, OT was the only AHP that was sought after for that primary care space at the time, and it's only latterly that the other professions from a therapist perspective were thought of, just because they knew and understood the value that had been built up from that evidence base within primary care.
Okay, that's really helpful. So it sounds like, I like that title of multiple masters, but it sounds like you had to sort of think what your core evidence and message was, and then just was it adapting it slightly for each of those masters, or were you creating completely new messages and arguments for each one?
I think it's always about adapting more than recreating, because I think what I've always centered my thinking on is what is my why, or what is the service's why, more so. So I'll use the example of a falls element of the service within it, that we could say we want to do a falls service because we want to reduce the amount of time someone falls, but is that really answering the why question? That the why question still digs further down into that and saying, well, actually, we want to reduce that because we want people to live their best lives. We want people to live independently. We want people to be able to engage in all the activities that they see of value, but also the activities that they have to do within their day. So from that kind of lens, you can still use the same message, but how you present that might be slightly different. So some people in operational sort of planning or management sort of roles will very much want to understand the data, will want to understand the return on investment, the benefits realization, those aspects to things. Whereas when you can maybe speak to other stakeholders, like your patient groups, it's like, what are you doing for me? How are you reaching me? What can I access that you can deliver, and is it accessible to me in the community, or do I need to jump through hoops and that side of things? And then from a GP perspective, the messaging was often, how can you save them time? How can you save them money, I guess? So you can always adapt what you're doing and what you're delivering to suit the message that you're going into. You've just got to kind of be mindful that sometimes it can be uncomfortable, and that's okay. Sometimes those conversations can be difficult because the challenge will come from a slightly different place, and you've just got to adapt to that. But most people are doing it from a place of wanting to understand more, not from a critical perspective. That's certainly what I found from my journey anyway.
Yeah, and actually I think that gives you confidence to put your head above the parapet if you hold that in mind, doesn't it, Alex?
Yeah. And I think you can do it at any band. I mean, I like I said, I did it at band 7, but I had great band 6s who all took on leadership elements within it as well. Swansea Bay, I did work as an 8A, and it was a different type of influence. So I wasn't necessarily as on the ground with the patient delivery, but now I had to set the role modeling and the standard for the staff that I had to do those deliverables instead. So I think even within your own teams, you have to influence and shape what you want to see and how that's going to be delivered, so that we're getting the best for the people that we're seeing and our citizens, really.
Yeah. So that's a really good example of where everybody is agreed that what they want to achieve for the local population, and then you're actually sort of positioning occupational therapy to meet the issues that they're wrestling with. And for GPs, it's often capacity, time, burnout, managing their budgets, because as you say, they are individual businesses. So it's adapting that to meet their top priorities. Okay, and then I just got one more question, Alex, and then I'm going to go to Leslie. But what did you find the easiest thing to do out of your experience? And I'm just going to ask if people can turn off their mic, because I can hear a bit of interference. Yes, what was the easiest thing about the whole journey that you've been on in primary care and community services?
That is an interesting one. The easiest thing is also probably that question you asked around being surprised about as well before. I probably shouldn't be, but just how much colleagues fell in love with OT as a profession, and in terms of what it could deliver and offer into most areas of work within primary care and community services. So clusters will often have evolving priorities every single year. The way that the funding model works, each year they're often on very fixed term sort of projects that they're doing. So they're always looking for those new schemes of work, or they might have different priorities that they've written into their intermediate term plans and all those sorts of aspects. the OT's ability to adapt, I think, just went down incredibly well to whatever the need was. We could apply ourselves to the mental health side. We could apply ourselves where there's cognitive issues. We could apply ourselves to the physical aspects. So actually selling the skill set of OT became very, very easy. They didn't need to understand the intricacies of everything that an OT did. But what they did start to understand is just that broad scope of practice that we could apply into any situation, which is what I guess put us on that stage to say we need more OTs, because actually they're much further reaching than maybe some of our counterparts in other areas. So like they were fixated on first contact practitioners from a physio perspective, but actually that was great to manage their MSK issues. But now we were managing all of this frailty side of things and the complexity that's built up around that and all the comorbidities with it, and how are people actually living with their health conditions day to day if they're presenting to a GP practice. And it's not a medical reason, but they continue to return there because that's the only option that that person has to go. But now they've got a different option as an OT, is available to go see them and assess them and look at that kind of complexity and what's going on for them. Yeah. That became the easy sell, because I think we can very quickly and easily become outcome burdened and get that fatigue of outcomes. And sometimes it's okay just to rely on the contextualized information as well about what we're delivering and how we're delivering it, and providing that back into the space. I don't think it always needs to be that quantitative element and this is what we've managed to do and this is the functional change that we managed to achieve. What's the feeling of the OT? And I think that's a lot of what the GPs and those practice teams really got from it, is they felt a difference.
Fantastic example, and I think you're right. Our occupation lens just allows us to have very flexible and transferable skills, so that absolutely we can adapt to different population groups and different priorities. Thank you so much, Alex. It's and my apologies about getting your title wrong. I'm behind the times, Alex, but congratulations on this role. I'm going to now ask Leslie to step up and come and talk to us about your experience.
Yeah, lovely. Thanks for having me along today. I'm Leslie Bone, Head of Profession Occupational Therapy in NHS Lanarkshire. So one of the parts of my role is responsibility for our local authority colleagues in one of our health and social care partnerships, of which we have two. And there was growing awareness in Scotland that because of the proposed National Social Work Agency, that was going to be potentially disadvantaging or excluding some of our occupational therapy colleagues within that sector. And we know that there are large numbers of our occupational therapists delivering excellent work. So we had local discussions with our Allied Health Professional Director, who I report to. We had an opportunistic visit from the Chief Allied Health Professionals for Scotland colleague coming to Lanarkshire, and we just asked for a little bit more time to discuss this issue. So we had to use that opportunity to raise it. That conversation was really helpful in terms of giving us some guidance and advice, but also raising the issue in the first place. I'm very lucky in Lanarkshire, along with many others, that we have a great relationship with Katie McGregor. So we also had good conversations with Katie, and Katie's been very active in trying to promote this particular area of concern. That then resulted in, and this is not all my work, but it's definitely I've been proactive in wherever I can in influencing and often using the relationships with people to influence as well as I can, the connections with people and the understanding of the bigger system. So then that resulted in a commitment by our Chief AHP, Caroline MacDonald, on the RCOT Members' Day in June, that there would be a deep dive into this area. So that was really, really fortuitous and helpful. Since then, we've had further discussions both locally and nationally. Many of our colleagues across Scotland have connected with one another, linking in with other partners such as COSLA, Unison, the wider AHP Directors Group for Scotland, and we continue to have local conversations with our other HSCP, although I don't have formal responsibility for them. We've got really good local connections, so trying to grow that voice in our whole area in Lanarkshire, connections with our AHP director and asking them to continue to raise it nationally. And there are other plans in the pipeline in relation to that deep dive. So I feel like whilst the issue wasn't my issue per se, I used my position and my relationships and understanding of the system to try and influence where we could. And it's very easy to do when you're passionate about the work that we do, and I know the successes of the impact that our local authority colleagues have. So Just one of the things that springs to mind is we really heavily promote the use of care opinion for all of our care groups. And the stories that I'm lucky enough to be able to see about the impact of occupational therapy go wide and far, and those are the things that absolutely motivate me, the impact and the diverse impact that people make. So that's something that I take great pleasure in sharing with as widely as I possibly can, so that people understand the influence. So that's kind of where we're at. So it's an ongoing story, but I will continue to influence that and be driven by making sure that those individuals have a voice, and that then protects the work that they do for the patients and the local authority. Thanks.
So thank you, Leslie. So part of what you've been doing is sort of advocating and amplifying on others' behalf and using your network. So it's a really good example of an illustration of some of the stuff that I touched on in the slides. What advice for everybody that's in the room would you give them for them to sort of try influencing locally? If they've never done it before, what would be your sort of top tips?
I would say probably just you have to try, always try. And I can remember 30 years ago when I had my first job in a big psychiatric hospital, I was in meetings with fairly senior social workers and colleagues, and I was brand new. But the thing that motivated me back then was the patients, because I knew them really well. I knew the work that I could do with them and the impact that I could have. So that drove me even then, even though I didn't have, lots of confidence or experience. But yeah, so always try. You just try. Your patients are at the heart of what we do, your patients and service users. Speak to as many people as you can, so you can influence even but without realizing it. You're just talking to people and it lands with the right person or not. Use all of your relationships to influence both formal and informal. And just remember the core of why we do things. It's always for our patients. So I think that's the thing that just drives us all. And you know that we have passion as a profession and we make great impact. So always try. Always try. The worst that will happen is that it won't land well, but or it won't land and continue, but you have to try, because at some level there will be impact. Yeah.
I'd agree, and I think I think most occupational therapists that have been working for a while, they're used to sort of knocking on doors and doors not always opening up immediately, but you've got to just keep, because it will give at some point if you just keep knocking. But it's staying motivated, isn't it? It's so I suppose it's trying to think of those examples where you might have had a conversation with somebody and it's clicked, and you feel it, can't you? Sometimes when you explain OT, sometimes you just see it clicking and you think, yeah, got it right that time. So yeah,
I think so. And you can and like I say, speak to as many people as you can, because you might find that there's a colleague who's a nurse or a doctor or a social worker or a psychologist who just understands and appreciates what you do. It might be because you've worked with a patient together, so they'll then become your advocates. Because so I think that's, if you don't articulate what you do well with your patients on every level, then they can gather momentum for you sometimes. So I suppose I always use the expression, you attack it from every angle, is what I would say. So if you're able to write a paper and influence up at the top, but you're able to speak to someone in the corridor about a patient's success, then I would attack it from every angle. And
that's a great. Do you know what? That's a great way. That's our motto: attack it at every angle.
Definitely. I say that all the time.
And I also like, Leslie, the last time I saw you, you interviewed me, so it's nice to be able to interview you today. So nice turning of the circle. Thank you so much, everybody, for your examples. I'm now going to hand back to Samantha, and we will then pick up any questions that people have.
Hello, thank you to all of our contributors and to all the speakers, and obviously to Karen for doing the interviews. I think we've got some really great examples there that hopefully have inspired you all to take away and think about how you can start influencing within your own organizations. So we're going to open it up to you now. So we'd love to hear any questions that you have for Karen or any of our other speakers. Karen will be leaving us shortly, but if there's any questions that we're not able to answer, perhaps Karen might be able to answer them later on. We'll send them to her, but we'll all try our best to do it. So if you have any questions, please put your hand up or share them in the chat. Or if you have anything that you would like to share of your own experience of having influence within your organisation, any tips for the other people here, we'd love to hear that from you as well. So yeah, just over to you, really. What I've got a question for all of you then. What has surprised you, or what has impressed you with what you've heard today from our speakers? Was there anything that you're going to take away and say, that was a really good idea, I'm going to try that in my organisation?
And Samantha, thank you. And hi everyone, I'm Taya Healy, Head of Profile and Campaigns, and unfortunately I was delayed getting here, so Samantha stepped in for me, so thank you very much. I had another question as well for others as well, was just to say, is there a challenge that you're particularly facing at the moment that you'd like to share, that perhaps sort of the hive of minds we've got here, other people might be able to share some advice on how you might address it? Would be another question I'd put out to the group.
You've got Kelly saying, I like the spotlight session idea. Yeah, that seemed to work really well for the East Cheshire team. And I think from what they've said, it's a really nice way to get people at all levels and all teams working across the organisation to just come and hear about what you do. Fiona.
Thank you. What a great session. I think from my perspective, and interested in others' thoughts on this, particularly struck by the comments about having service users and patients involved in some of the influencing work. And I've been at stakeholder meetings before, and as Karen says, you can really see it in people's eyes when they, sit up and listen. There's no more powerful example than having service users and patients involved. So just my reflection. I'm sure others have other ones, so thank you.
Leslie, do you want to come in?
Yeah, lovely. I suppose what was on my mind was something that's increasingly important to me, and of course others, and I would recommend, is the use of data. And I'm not necessarily the best person with numbers, but I'm very lucky to be surrounded by lots of colleagues who are. So I know that the more that we can evidence what we do, so those really powerful stories about a person, a family, a situation, but also being able to gather data and interpret it really well, tell the story with the numbers. I think that's becoming increasingly important. And there are lots of ways that people can do that. There are lots of systems that we can use to help to support that. So I think those are the two bits. We mustn't forget the numbers. And the numbers need to be, qualitative too, but the quantity does have huge value, I would suggest. Yeah.
Thank you. Claire. Oh, Claire, you're on mute.
Apologies, sorry. Just to add really about what's currently been discussed and give you maybe a little bit of an insight into OT week for us here at 2025 is exactly what we're speaking about. We're doing an OT roadshow and getting out there this year. So we did the spotlight sessions last year. It's amazing. Take it forward, build on it. It would be great to see what comes of it, but this year for us is the roadshow. We're getting out into the community, we're meeting with service users and letting their voice speak. So that's just to kind of reflect on what's been spoke of. And you mentioned about data and the importance of data, and I feel that we're instilling that slowly in the coming months. Is we have the data, it's how do you interpret it? So hoping to infiltrate into all that we do, kind of the best way to showcase that as well. So
that's fantastic, thank you. I love that idea of the roadshow. And I think that's one of the most important things. It's having that balance of having the data to show it, combined with having those real examples of where you've helped real people and having their voice in it as much as possible as well. And there's a few things in the chat, so I'm just going to come to the chat. Kerry's shared that one of the things they're going to be doing for OT Week this year is going around to local colleges and encouraging health and social care students to consider OT as a career. That's absolutely fantastic. I love that. And hopefully you'll manage to convince some of them. I think OT is one of those things that a lot of people haven't necessarily heard of, but then when they hear of it, they realise what a varied career it is, and they can do so much with it. So sometimes it's just getting in front of the right people, which is what this session is all about. Gemma's shared that in her first year of being qualified, that she is in her first year of being qualified. She did an apprenticeship degree and was previously surrounded by a big team of OTs, now working for a homeless charity and the first OT and clinical employee. So she's asked if we have any advice for someone in emerging roles, standalone OT, what realistic campaigns could I do that will be impactful? I'm going to first come to our contributors to see if any of you have any suggestions for that. Leslie, was that in answer to this question?
Yeah, I think so.
Yes, please do come.
Yeah, lovely. And I think it's just, and it might sound easier than it is in reality, depending what your structure is. But I think just try to make connections with other people who are working in that sector to some degree. So I think that's again about trying to put because there will be other people doing. So there's colleagues in Scotland, for example, that you might want to link with me around. But I think that's the first thing I would suggest is try to touch base. So I know obviously via RCOT you have your, and I've completely forgotten the name, but your connection areas, the stuff that was launched in June. Apologies. So I think that would be where I would go. So try and touch base with other people who are working, you know, in perhaps the homeless sector, whether it be charity or otherwise, and try to find your connections. I think the communities platform. Thank you. Apologies, I just couldn't remember the name. Yeah, thank you.
Thank you, Leslie. Claire.
Just to add on that, actually, we're kind of in sync in the discussion points. Really, is I was going to just add about the importance and maybe benefit of engaging with your service users to develop the foundation of what you want to promote. And what I mean by that is I've been in a similar situation in the past and utilised actually our frameworks and assessments to gather the voice of your service user, and then from that you will find naturally develops the concept of what you want to display for your specific area. Did that come across? Have I explained that right? Do you understand what I'm trying to say? But yeah, I go to the foundations of what our profession is on, the you know, the assessments that are out there that you feel that would reflect correctly in your field to get that voice heard, and then you'll see. I just feel that that will give you a foundation to grow your thoughts and build on that. I hope that helps at all.
Thank you so much, Claire. Gemma, hopefully that's helped and hopefully that's answered your question. Oh, good. She said it's very helpful. Thank you. So thank you to both of you. So I think we'll probably move on to the final section of the presentation now. Thank you all for sharing your experiences and your ideas, and do keep them coming in the chat because we do love to hear from you. Let me just see if I can open this presentation again. Here we go. So just for the last, sorry, I'm trying to find the right slide. From the last section, we're just going to be talking about the profile raising tools that we have created for you all to use. They're available on our website. We launched these last year, but we're still very relevant, and we're still continuing to update them. So for this year, we have added a document about understanding your sphere of influence, which was obviously talked about in this session. So I'll just talk you through the tools that we have available to help you raise the profile of occupational therapy, and do have a look at our website afterwards and explore what's available. The campaign isn't just about one-off actions, it's about building confidence, consistency and momentum. We have to start somewhere, and quite often it will be a slow start that will then build and hopefully at some point, you know, metaphorically snowball and become much bigger and faster. That's why we've created a toolbox with five practical areas you can tap into, which are prepare your story, be a spokesperson, get social, influencing decision makers, and act local, which is what this section is about. Prepare your story is all about using those real examples to show the impact of OT and understanding how to tell that story and how to draw people into what you're trying to say to them. You can be a spokesperson, whether that's speaking at events, writing blogs, or engaging with local media. And there are some practical tools within the resources, the profile raising resources, to help you do things like write a pitch email to a journalist or write a press release. And I'm happy for people to get in touch with me for support on that as well. You can get social using platforms like LinkedIn or Instagram to share your message and connect with others. Again, there's resources within the package to show you how to write some posts and how best to use social media. And I think there's even a guide on how to make videos for social media, so have a look at that. You can influence decision makers using the relationships we've just mapped out in your sphere of influence. And there's also information within the toolkit about writing to your MP, how to set up a practice visit with your MP, and things like that as well. And finally, you can act local, as we've been discussing today, by engaging with your community, your workplace, or your local council. All of these tools are designed to help you take action in ways that feel authentic and achievable. You don't need to do everything, just start where you are and build from there. And we certainly wouldn't expect everyone to be doing all of these things. So pick the thing that feels most accessible and realistic for you, and the thing that you think will get the best results for you. You'll find all of these resources on our website, and Taya's already shared the link in the chat, so you can click through there. So I think, Taya, is it over to you now to close the meeting?
Yeah, which made more sense if I was going to be the one that opened it, but I wasn't here to do that. But I'm very happy to close. And just to say thank you to everyone, including our OT guests, for speaking. I think that the insights that you've shared have been really, really valuable. The only thing I was going to finish off with was just a reminder, as we said, we've got the tools there from profile raising, as well as the campaign that we'll be launching with that real focus, as I think Samantha talked about in the beginning, around prevention and early intervention. But also a reminder to say all of this counts towards your CPD. So please do take time to reflect on what you've learned today and capture that and any actions you plan in your CPD portfolio. And please do start planning your campaigning and influencing activities so that you're ready for OT week, and use the resources that are there to support you. And we look forward to seeing what you're doing and hearing more about it. And please encourage your colleagues to come along. I think Chanel has kindly just put up the poll again. Be really helpful. I know you answered this at the beginning, but if you can answer again now, it's really just to help us see if there's been any real impact from the session that we've had today. It helps us to judge the impact that we're sharing with you. But that's everything. Thank you all so much for taking the time to come. Really appreciate it. And yeah, and please share the tools and everything with your colleagues as well. Thanks all.